let's go ahead and get started right off the bat. And Dr. CLAIR FRANCOMANO, hello and welcome to the call.
Thanks, Dan. Great to be here.
Now, CLAIR, I have an awful lot of questions that have come from people that said, you know what, I've Google searched Dr. FRANCOMANO, and she's done so many things in so many places with Hopkins and the Human Genome Institute and National Institutes of Health, and on this board and on that board. You've spoken all over the world and sat on boards globally around the world. It's confusing, so if you could help us just appreciate just a little bit about your background and history. I know that you don't like talking about it, and I know it's embarrassing to you, but tough. I'm going to ask you to do it anyway. You know me, I'm a turkey. Would you please just give us a very synoptic view of your history so that we can clarify a lot of stuff? Because I know a lot of people are saying different things, and they're confused about who you are.
Sure. So, I started my medical career at Johns Hopkins in Baltimore. I went to medical school there, and then I did training in internal medicine and later in medical genetics. And I became board certified in internal medicine and in clinical genetics and molecular genetics. And my main interest in genetics was in the hereditary disorders of connective tissue, and over the last 25 years, I've done a lot of research looking for genes that cause those conditions and also studying what we call the natural history of those conditions, looking at what happens to people over time who have those particular disorders. So after I finished my training, I was at Johns Hopkins for 10 years on the full-time faculty, and then I left there to go to the National Institutes of Health in Bethesda. I kept my faculty appointment at Johns Hopkins, and I still have a faculty appointment at Johns Hopkins. But at the NIH, my first position was as the clinical director of what was then just the baby beginnings of the National Human Genome Research Institute. At that time, it wasn't even an institute. It was still called a center, which is a smaller entity at the NIH. And I spent 7 years at the Genome Institute, and then I left there and went to the National Institute on Aging, and that was mostly done for personal reasons. My family was in Baltimore, and I just got really tired of commuting down to Bethesda every day, and I felt like I wasn't spending enough time with my children who were growing at that time. They were still quite young when I moved back to Baltimore and the Aging Institute. So, spent 4 years at the National Institute on Aging, and now I'm the Director of Adult Genetics at the Harvey Institute for Human Genetics, which is part of Greater Baltimore Medical Center, still studying the hereditary disorders of connective tissue, and now spending a lot more time actually hands-on patient care with those patients with these disorders, and also a little bit back to my roots in internal medicine and doing some direct patient care in that arena as well as some teaching. We have a residency program in internal medicine at Greater Baltimore, and I'm involved in that.
Wow. CLAIR, you have provided to me your CV, your curriculum vitae. And for those that would like to see it, just to understand who you really are, is there an objection on your part that if we were to share your CV?
Not at all. It is what it is.
It is
my
what
history.
It is. You've done 1 or 2 human clinical trials, and you've managed $1 or $2 while you were at the NIH. What was your official title when you were at the National Institutes of Health?
The first one was clinical director for the National Human Genome Research Institute, and I was also a branch chief of the medical genetics branch at the Genome Institute.
And you were there when the human genome was being mapped, is that correct?
Yes.
How exciting was that?
It was really exciting. It was a very, very heady time in genetics. That decade was really, really exciting time.
In history, there are certain milestones that medicine and science reaches, and there will only be one point in history when the human genome, all of the genetic material was sent in from around the world to be analyzed. To be there during that process in the position you were in, it just had to have been crazy fun.
It was very, very fun and interesting, yes.
Well, let me do this, Claire. We've got a testimonial that I need to work in because this individual has some other commitments he has to get to. Guys, we can hear you. I don't know how that's possible, but we can. So be very careful not to talk while we got the call going. And what I'd like to do, Claire, is introduce a gentleman that is willing to share his personal experience. And I know that in the normal world of medicine, we have to be very careful about HIPAA laws and disclosing patients' things, but this is not your patient. This is just a person that says, I'm willing to share my experience on these products. And I'd like to have you interact with he and I to explain the medical implications of what happened to him. So with that being said, Walt, can I get you to come on?
Sure, I'm here.
All right. And Walt, we'll let you kind of stay incognito a little bit here. And if you want to volunteer anything about yourself, I'll let you do that yourself. So I'm not going to introduce you other than just you're a person who used our products, okay?
Fine.
Walt, I'm holding in my hand an email you sent to me that made my jaw drop. And I'm just going to read a piece of it with your permission. Is that all right?
Sure, go ahead.
It says, hey, Dan, I'm on your call right now. This was last week, a week ago. And you wrote, interesting, in parentheses, not surprising. I remember that you said, if my friend, blank, so-and-so, would take Kyone for 2 weeks, his health would change dramatically. And then you went on and chronicled what happened to you, yourself. Here's my story. I've been on Kyone for about 2 weeks. My blood pressure was 155/98 to a high of 171/102, with a pulse of about 88 to 92. And that's on medication, is that correct?
That's correct.
And how long has your blood pressure and your pulse rate been elevated like that?
Probably a year and a half to 2 years. Sometimes the medication would drop it down to maybe 155/95, but it never went below that.
Okay, and you were working with a specialist, not just a GP, is that correct?
That's correct.
So you weren't working with just a family doctor or a general practitioner. What were you working with?
Well, I was working with both a general practitioner and our arterial specialist in, there's probably a better name for it than that, but specializing in arterial problems with arteries and veins and so on.
And was this person possibly a vascular surgeon?
Yeah, I'm sorry, a vascular surgeon is exactly what he is.
Okay, very good. So you were working with really quality medical care.
Absolutely.
And you were taking what they were prescribing and they were working with you closely on your medications, is that correct?
That's correct.
Okay. Now, in addition to having the high blood pressure and the elevated heart rate, your heart was beating faster than it should be, you also had a problem with phlebitis. Can you explain that to us?
Yeah, the last day of January, I had a severe problem with phlebitis in my right calf, and it just happened. And about 20 years ago, I had a blood clot in that same calf, which went away. I was in the hospital for 10 days then. And, of course, they put me on anti-inflammatories and some heavy medicine for the pain. And it receded probably over a 3-week period. And, of course, they kept me on my blood pressure medicine, and they did tell me that phlebitis could come back, whenever it feels like it. And the results of that were some very hard veins in the back of my right leg. That they were not quite varicose veins, but they were very, very hard. And can I give you a timeline here, Dan?
Please.
Okay, you called me, I'm looking at my notes here, you called me on Tuesday, March 9th. And a conference call with KC, and you told me about this product. And I said, hey, sign me up. And my product arrived on Monday, March 15th. And I started taking it. I flew to Seattle March 18th to meet you and the rest of the people from Kyone for that great meeting. And I was fortunate that night to have about